perform the procedure, that is nail care and foot care.
The nail care and foot care is provided to the patient to prevent the infection from bacteria and to promote the hygiene of the patient.
Thank you, Kushi, for explaining to us. Now, let us give a brief introduction that what articles or what equipments we are using in this procedure. Let us go through. One Macintosh sheet, a wash basin full of warm water, and the temperature of the water should be 43 to 44 degree of Celsius. Two face towels, one face cloth, an antiseptic solution, a sanitizer, a moisturizer. We can use anything, whether it is a moisturizer, whether it is a hand cream or any ointment. A soap solution, a kidney tray, a nail cutter, some cotton swabs, a bowl, and two pair of gloves, as we are two which are performing the procedure. Now let us put all the equipments aside on the side table. A big instrument tray, of course. In the procedure, we have to make sure that our hands are germ free. So let's sanitize our hands first. And now we have to wear gloves. Use the proper glove technique to wear the gloves. We have wear the gloves. Now, before starting the procedure, we have to make sure that we'll maintain the patient's privacy by pulling off the curtains and locking the door of the room. Now, we have to put the cardiac table towards the patient and make patient sit into a comfortable position, and the position name is fallen position. Now, place the Macintosh sheet. We are placing the Macintosh sheet.
To prevent the spillage of water.
Yes. And now take the wash basin. Put the soap solution into it. Mix it thoroughly, and now soak the patient's hand into it. Soak the patient hand for 10 to 15 minutes. And now use a face cloth to wipe water, and use a dry towel, of course, to make the hands proper dry. Now we will use the antiseptic solution and the cotton swabs to clean the root of the nails or the fingertips or cuticles of the patient. Do it slowly and very firmly. We are doing this because to prevent the patient's nails from the germs if there is any germ present. We'll discard the cotton swabs into kidney tray, and then we'll discard it into a paper bag, and we'll transfer it to a yellow bin. Now, again, with using clean warm water, the temperature of the water will be as same as we told you earlier, that is 43 to 44 degrees Celsius, and will only dip the patient's hand into the water for again 10 to 15 minutes. cutter to cut the patient's nails. This is the important and the main step into the whole procedure, where we have to do it very carefully and very gently that patient will not get hurt. We have to clean it very gently so that no extra nail or no skin or cuticle will come. Now with the help of a nail filer, we'll give the
Patient's nail shape.
we have we'll sterile the nail cutter. Now the extra nails that we have cut, we'll discard it into a paper bag and then into the yellow bin. Now the last but not least step, that is moisturizing the hands of the patient. We can use a moisturizer, any hand cream or any kind of ointment. Prevent crackle that can be on the patient's hand. Now we are giving a patient foot care. For this, we have to now we'll put the Macintosh sheet on the bed to prevent the spillage of water on the linens. We have to dip the patient's foot into the water, and the temperature of water will be the as same as we are using into the hand or nail care. Putting a towel onto the Macintosh. Drying the patient's feet. Using the antiseptic solution and cotton swabs, we have to clean the patient's toenails. We'll discard it. Now, with the help of the clean water in face wash into the wash basin, we'll again dip the patient's foot for 10 to 15 minutes, and then we'll dry it. After 10 to 15 minutes, we'll dry it with the clean towel. Now using a nail cutter, we'll cut the toenails of the patient. We'll discard it into the kidney tray, into a paper bag and into the yellow bin. With the help of the nail filer, we'll give the shape to the nails. Now the last but not least, we'll use a moisturizer to moisture the patient's feet. We have to moisturize the ankle region very much so that no crackles will be appear. swabs or the nails. So as I told you earlier that we have to discard it into the yellow bin, as our yellow bin says that it should be used when we have to discard anatomical waste like body tissues, organs or any body part, or solid waste like cotton swabs or blood or urine bag or any used linens. So let us discard. Now we have done our whole procedure complete. Now our procedure is complete and our patient is germ free and infection free. Thank you
Thank
for
you for
watching.
watching.